Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Welcome to Health for Life. Today we're talking with Dr. Thomas Flynn, a palliative care physician at Hamilton Physician Group Specialty Care in Dalton, Georgia. Dr. Flynn, thank you for being here.
Thank you so much for having me today.
Well, we are very excited to have you in the studio, and honestly, we have a pretty important subject from what I'm reading, and that is palliative care. And for people who may not know, which includes me, how would you even define that?
Well, that's a great question. A lot of people don't know what palliative medicine is or palliative care. And what it is, it's a specialized medical care specifically for patients with serious illness. And these can be patients that see their cancer doctors, their lung doctors, their heart doctors. The focus of palliative medicine is on symptom relief and helping with pain management and emotional support. And this is all done alongside the curative treatment. So it can happen at any point from when you're diagnosed to any time after that.
So who exactly will benefit from this type of care?
Yes. So it could be anyone with these serious illnesses, and importantly, if there's a life-limiting feature of them. So it can be anyone with cancer, heart failure, COPD, any type of neurological disease, and it in some way is this disease preventing them from living their best life. And the eligibility is based on need, not on life expectancy, or if they've been told how much time they have left.
What kinds of services are going to be provided with palliative care?
Well, when I see my patients, the focus is on quality of life. So that can be symptom management. Is their pain under control? Are they feeling nauseous, breathless, difficulty sleeping? And the essence of palliative medicine is whole person care, and it's focused solely on the patient. So this can also be looking at psychosocial support. Are they having mental health difficulties with anxiety or depression? Talking about counseling, or another aspect of that is their spiritual life. It can be their faith or religious background. And the third thing is being able to do advanced care planning. Now, what that means is spending time with patients to understand what are their values, what are their goals, their choices. And I call these conversations gifts for the family, because it can tell family members, this is how I want to be treated if I weren't able to communicate with you or I was in the hospital. So these family conversations kind of help get everybody on the same page. So a lot of my job is education and communication and spending time with patients and families, learning what is truly most important to them and how we can structure their medical care around their values.
It almost sounds like, just from this initial definition, that it could be almost just like hospice. Is it similar, or how is it different than hospice?
Oh, absolutely. There is some confusion because palliative and hospice are thought to be the same thing when they're different. And here's the nuance or the difference. Hospice is for end-of-life care. It's typically when your doctor says, we think you have 6 months or less. And from a medical perspective, there's no further medications or treatments that we think can give a cure at the end. And that's hospice. Palliative has a very similar philosophy of focusing on comfort. Both of them focus on comfort. But where palliative is different is palliative medicine can be done early, and it can be done at the same time as if you're a cancer patient getting chemotherapy or COPD and getting breathing treatments. It can run in parallel with these ongoing treatments, and it can begin at any time. But both of them are focused solely on comfort and quality of life, but they're given at different times and for different reasons.
We've had people on the show before talking about how there's a lot of misunderstandings with hospice and myths surrounding it that are negative and positive. Are there the same myths surrounding palliative care?
Absolutely. They're very similar myths. The first myth is, if I'm using palliative care, it means I've given up. And actually, it's the complete opposite. The focus is not on giving up, but it's about living better and having your best day being today. The other myth is we can only do palliative medicine for something that's in the late stage, and for instance, late-stage cancer. But actually, many conditions, as I mentioned before, it can be anyone with problems with their heart, their lungs, their liver, their kidney, their brain. So it can be many different things that apply. It's not just for late-stage cancer. The third myth is that using palliative medicine, if it might shorten my life. And the common thought is, if I stop chemotherapy or something, my life will actually shorten. But actually, there's been medical literature that shows that doing palliative medicine at the same time and in support of these other treatments, it can actually improve outcomes for patients.
With this palliative care, how does it get paid for?
Yes, and that's something that's on the minds of many patients, and it's often covered by Medicare, Medicaid, and most private insurance plans. So it's something that has a broad appeal to the payers on the backside of medical care behind the scenes.
And you mentioned how it's a big myth that people think it could shorten your life. Could it actually help you live longer in some cases?
Surprisingly, yes. They've done some medical research and has shown that people receiving palliative care sometimes actually live longer than those who don't. And that would seem counterintuitive. Why is this? Well, that's because their symptoms are better managed. And your physician does a fantastic job managing symptoms. My only difference is I have more time to go into the nuance of it. And that, by spending time to build relationship and doing more education and communication, we find that patients and their families, it's very important that this is all together, the stress is lower. And with that further education and choices, there is the definite benefit of avoiding unnecessary hospitalizations. So it's not just about comfort. It's about positively impacting the length of life or longevity, helping people feel their best. And when you feel your best, your health responds in that way.
And with this care, does it really emphasize just making your own choices and helping them with those decisions?
Mm-hmm. A big part of this is decision making. And that's where I found in the hospital a lot of anxiety and stress come up. So I mentioned before, it's not only helping patients, but it's also helping families understand their options in plain language. So a lot of what I do is take the recommendations and the hard work of the other doctors taking care of a patient and synthesize that into plain language so that, if there was a miscommunication before, being able to, for everyone to be on the same page. And that's where having fewer patients, having more time with them can really be a benefit. And we talk about the risks and the benefits of those different treatments. And it all comes down to the patient and their values and their goals. Saying, is this of benefit to you? Why or why not? Here are some of the risks, the side effects. And we make sure that the care plan reflects what the patient truly wants, giving time and education and family input and, my recommendations to say what is not just medically possible, but what is most beneficial for how they want to live their life. And so this kind of support often leads to more confidence and less stressful decisions, and definitely more support from family being on the same page and feeling like this can be an inclusive decision that, all of us can be together in.
Is this only something that you can get actually in the hospital?
No, not at all. So palliative care is flexible. It can be provided in many different settings. So right now I'm providing it in the hospital. It can also be done at home, in nursing homes or assisted living facilities, and also through outpatient clinics. The essence and the drive of palliative medicine is not to have an agenda, but to meet the patient and family where they're at and to give them the best care possible. And that goal is to bring that care wherever the patient is in the setting that makes the most sense for them, where they're the least anxious and the most secure. So we're actually going to talk about palliative care at home in the next show. So please be sure to tune into that episode as well.
Dr. Flynn, thank you very much for discussing palliative care with us. And to our listeners, if you or a loved one are in need of palliative care, visit vitruvianhealth.com/specialty care or call 706-529-3072. That's 706-529-3072.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.